It does sound scary. I'm speaking as a parent myself.
Growing concerns about a rare illness spreading among children. The new move to stop the spread as one of the first patients returns home. It's lights out on Broadway when the curtain could rise again. Plus, liquid gold, the Bronx distillery swapping spirits for hand sanitizer to help our frontline heroes. Good evening. Thanks for joining us. I'm Natalie Pascarella.
And I'm Chuck Scarborough. New York hospitals are now prioritizing the testing of children as cases of rare and dangerous illness possibly connected to COVID-19 grow. At least 100 children have been sickened across the state, 52 in New York City, and at least 3 young people have died from it. And within just the past few hours, we've learned that one of the first children diagnosed with that illness was just released from the hospital. News 4 Government Affairs reporter Melissa Russo broke this story, and she has the latest developments for us. Melissa.
Chuck, when 8-year-old Jaden Hardwa went into the hospital late last month, almost nobody was talking about this serious inflammatory sickness now impacting so many kids. Now Jaden is out of the hospital. He seems to have little idea why all eyes are on him right now. A healthy boy, no underlying medical conditions, who went into heart failure. A heartfelt send-off for a brave 8-year-old Cub Scout from Queens. Jaden Hardwa was honored today by the doctors and nurses at Cohen Children's Hospital, who saved his life after he went into cardiac arrest late last month. Back at home in Richmond Hill, Jaden arrived to a hero's welcome from city police and firefighters after a terrifying ordeal.
A little kid carrying normal temperature, sleeping in the bed with his mom. Lying in the bed with his mom, and then he went into cardiac arrest.
Jaden's heart stopped as he watched television in bed with his mom. He was suddenly unresponsive.
I quickly looked over at his face, and I saw his lips are all blue. I started yelling out for his name. He wasn't responding to his name.
As we moved down Atlantic Avenue, in my mind, all I'm thinking about is Jaden. Is he going to make it?
It happened on April 29th, the same day the News 4i team first asked local health officials about what we were reporting, that multiple children throughout the city were having similar experiences.
We have not seen this to date.
Jaden did have some symptoms, fever and diarrhea, but at the time, the word about this new syndrome had not gotten out.
He starts to become a little bit weak. And this, we follow up with his doctor, his pediatrician, and they thought that, he will come around.
Now, parents throughout New York State are on edge, with at least 100 children hospitalized and at least 3 children dying in just the past few days from serious inflammatory sickness believed to be an overactive immune response that develops weeks after the child was exposed to COVID-19.
This is a truly disturbing situation.
A lot of us know of Dr. Fauci, and a lot of parents believe what he says. Now, we really want the top doctors to be on the news and tell us more about how children are being affected now.
About a week ago, Jaden's father told us he wished that Dr. Anthony Fauci would talk about how children are being affected. And today, at a Senate hearing, Dr. Fauci did.
We better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects.
And Jaden's dad tells me today that he's going to need a little bit of therapy as he recovers. He's looking a little dazed by all the attention as he rejoins his family after a fight for his life. Of course, all of us here at News 4 wishing Jaden a really speedy recovery. Chuck?
Indeed we do. Thank you very much, Melissa. We heard Dr. Fauci in Melissa's story. He says he does not expect the COVID-19 vaccine to be ready by the start of the next school year. But at a Senate hearing today, he told lawmakers that if communities take proper precautions, they can limit the number of new cases.
I would hope by that point in time, in the fall, that we have more than enough to respond adequately. But if we don't, there will be problems.
Fauci also told the senators he's basing his advice strictly on the best scientific evidence, not any other criteria.
Tonight, there is some progress in New York as the statewide pause order ends this Friday. Only 3 regions, though, are ready, but more are getting closer. Our area still needs fewer hospitalizations and more hospital bed capacity to meet all 7 metrics to reopen. Governor Cuomo says without $61 billion additional dollars in federal aid, New York will be forced to slash the state budget by up to 20%. That's cutting funding for schools, hospitals, and first responders. In the city, 12 new testing sites will increase capacity to almost 11,000 per day. That's by the end of May. And sadly, Broadway theaters will stay closed until at least September 6th. A lot of new developments today. Let's head over to News 4's Andrew Siff, live in Midtown with the latest to break it down. Andrew.
Hi, Natalie. There's an unusual line outside of the Richard Rogers Theater here on West 46th Street. It's not a line of theater goers, it's a line of buses. And these buses transport nurses and other frontline workers to city hospitals every night around this time. That's the state of play as the Broadway theaters are closed, not just now, not just until June, at least until September 6th, and probably for many more months. The crossroads of the world still hauntingly empty, and the show won't go on before September 6th, a date health experts already consider unlikely. And there are also dark days ahead for mass transit. The MTA already losing billions of dollars as ridership has dropped more than 90%. Today on a Zoom call, I asked the heads of several transit agencies how to keep riders away from each other when business reopens. How close are we to implementing social distancing on trains?
We're consulting with public health officials, academics, et cetera. And on this important issue, no decision has been raised.
SEPTA is doing similar things with rider limits as well as looking at capacity.
Meanwhile, in Binghamton, Governor Cuomo talking about data points that allow regions of the state to open this week. A reminder on his map showing metrics met. The city still fails to qualify in 3 categories: ICU admissions, hospital capacity, and hospitalization rate. The governor said New Yorkers should wear masks.
This mask says, I respect the essential workers who get up every day and drive the bus or drive the train or deliver the food or keep the lights on so that I can stay home.
Amid that unsettled backdrop, new questions about the fall. On Monday, the teachers union said more than 1 million school kids may need to alternate between going to class and learning from home. And the union said they need that plan finalized soon. Wondering what you thought of that and whether you're embracing that.
We've got a fair amount of time. I mean, remember, we were talking about most of 4 months before school opens.
If we do a staggered schedule programming, we need to know that in the next 2 to 3 weeks.
2 or 3 weeks, an indication from the teachers union that they want clarity on what the plan is for this fall pretty soon. We're live in the theater district. Andrew Siff, News 4 New York.
Andrew, thank you. New Jersey recorded the state's lowest daily new case number since March 25th. Fewer than 900 confirmed cases over the last 24 hours. The number of COVID deaths in that same period was 198. The path to reopening in New Jersey requires testing kits and contact tracers. The state's Department of Health is now requiring all long-term care facilities to test all their staff by May 26th. The state hopes to perform at least 25,000 tests a day by the end of next month and hire at least 1,000 contact tracers. News Force Brian Thompson is live in Englewood with the latest for us. Brian.
Yeah, Chuck, Englewood, of course, having hundreds of positive cases, one of the epicenters in Bergen County, the epicenter for New Jersey. And for the governor, anyway, he says that New Jersey has the highest rate of hospitalizations, of positive cases, even deaths, here in the most densely populated state in the nation. Reasons, according to the governor, to emphasize testing and tracing to get on top of this disease. The saliva spit test outside, blood testing inside this van. Today, Bergen County launching mobile testing from town to town. Neighboring Essex County exec Joe DiVincenzo explaining what's taken so long statewide.
We had to wait until we had enough PPEs, and getting the PPEs was a problem, not only for us, but throughout the country.
Statewide, Governor Murphy wants to more than double testing to 20,000 people a day by the end of May. Top priority will go to hard-hit nursing homes, more than 4,000 dead. The goal, all residents and staff tested in the next 3 weeks. 1,000 more contact tracing jobs will be added. Applications now being accepted. Once someone at any of these testing centers tests positive, the challenge is to find who they've made contact with.
Listen, I'll always take more help. There's no doubt about that.
But testing and tracing is drawing privacy concerns on social media.
From a public health perspective, we always want to make sure that we ensure the confidentiality of the case patient as well as the contacts.
Essex exec DiVincenzo was here today with Bergen exec Tedesco. Both are COVID-19 survivors. It's personal.
If we ever open up very, very quickly, we're going to get back to where we were, and it's going to get a lot worse. Listen, I had the disease. I know what this disease can do to you. You know, I was one of the lucky ones.
Multiple testing sites being announced today across Bergen County and all of New Jersey, for that matter. The governor says that is key to reopening and key to the dates that he expects he'll be able to announce by the end of this week for various phased reopenings of this state. Live in Englewood, Brian Thompson, News 4 New York.
All right, Brian, thank you. From the latest on testing there in New Jersey to Connecticut now, where sadly we've learned of another 33 deaths just since yesterday. But we do have some progress to report. The number of people in the hospital across the state is down. This all comes amid a shakeup in leadership. Governor Ned Lamont fired the state's current health commissioner, Renee Coleman Mitchell, after a series of missteps last year in her handling of the pandemic response. Department of Social Services Commissioner Deirdre Gifford is now the acting commissioner.